Good morning, all. ashtanghrudayam sutrasthan ashtanghrudayam sutrasthan के रीडिंग में आप सबका स्वागत है. We were on trividha parikshana. Darshana sparshana sprashnehi pariksheta cha rogina. Okay, we were talking about this parikshana. In that, we have already discussed about the darshan parikshana. Today we will elaborate about this sparshan parikshana. Okay, sparshana. So when we talk about this Parshan Parikshana, so what we actually according to disease, डिसीज के हिसाब से जब हम देखने जाएंगे तो हम एक्चुअली क्या देखते हैं मेनली what we actually see according to disease, how we see the Jora Parikshana, Raktapitta Parikshana, Yashma Parikshana. In this type of patients, what is the role of Sparshan Parikshana? So let's talk about that. Sparshan Parikshana actually we see mainly the examination of touch to access the ushnata, shitalta, sandrata, tenderness of pain, swelling, kampa. These type of things we going to see through sparshan parikshana, right? Okay. Now we're talking about the scope of application of sparshan parikshana through jwara to vatavyadi in neuromuscular disorders. The clinical role of the sparshan parikshana in complementing along with the darshana and prashna history taking, that is also very much important. We will talk later about the prashna parikshana, how the prashna parikshana case taking will happen. We will talk later, but in ashtanghrudaya they have these three with the parikshana is very much elaborately explained, that we are going to see in disease wise how the sparshan parikshana goes. In example of jwara parikshana, the excessive heat, sweating skin, dryness, tenderness, we mainly see through the sparshan parikshana. Modern correlation, that palpation of skin temperature, pulse rate, dehydration of signs, dryness of skin, looseness of skin. These are all the things we can see through sparshana parikshana, darshan and sparshan parikshana. Can you able to see the screen? आप स्क्रीन देख सकते हैं? Yes or no? Just discuss with in a chat box. Okay. In Raktapitta disorders, also the warmness over the skin, tenderness over the skin, soft, mild swelling near the part of the abdomen, below the eyelid, we can see. And also in what we can't say that excessive bleeding cases. In excessive bleeding cases also, the we can see through darshan parikshana that the pallorness is happening, and along with the dryness of mouth, these are the things we can see through the darshana. But what actually we see that in case of the uh, dysmenorrhea or menorrhagia, the mild pain in abdomen, through the abdominal examination regarding the position like a PCOD, where the ovary get tender, and during the palpation we can go through with the at the site of the pain. Kushta skin disease, mostly we can see through the sparshan parikshana, is roughness, hardness, loss of sensation. Okay, dermatological palpitation and induration hypothesis. In case of sotha, edema, the pitting, non-pitting swelling edema, cold and warm of touch. In modern examination, pitting test, local temperature, we can go through it. In arthritis, stiffness, cryptus, tenderness, these are the things. While going through this Sparshan Parikshana, we can understand a palpation of joints for swelling, warmness, and restricted mobility part through doing the physiotherapeutic exercises in the arthritical patient. Through physiotherapeutic exercises, we are understanding the stiffness and the pain of that patient. In case of the Pakshaghata, like a hemiplegia or paraplegia, the coldness, rigidity, loss of tactile sensation, loss of motor sensation, loss of sensory sensation. In neurological examination, like the tone, reflexes, sensory loss, through the neurological examination, like to the peak of the hammer, we can go through the reflexes, and we can understand the how the reflexes is going through, like from grade 1 to grade 3. Okay, so in Vatvedi, also in case of the neuromuscular disorders like coldness, roughness, tremors, uh, stiffness, urustamba, urastamba, amavata, in this type of cases we can understand the stiffness of that particular part or the particular sandhi. And many times in cases of the lumbar bulging or lumbar bulging of disc or the intervertebral disc degeneration, where we can find out the neuromuscular pain and some type of referred pain, or sometime patient tell that the tingling and numbness, and sometimes the sensory or the motor loss, and sometimes the muscle lost is also we can see through uh, through the neuromuscular disorder. So let's talk step by step. What we actually see that in Sanhita Sparshan Parikshana is emphasize a crucial diagnostic tool for Jwara. It allows the physician to assess the quality of heat, distribution, consistency, and tactile changes in the body. In according to Ayurvedic perspective of Sparshan Parikshana, we can see the Ushnata, Shitalta, Sharirta, like palpation, and Nari Sparshana. In Ushnata, in Samajvara, the heat is uneven, sticky with heaviness, Guruta. In Niramajvara, the heat is clear, dry, and morely uniform. In Vata Jwara, the cold and rough touch of the nadi or the shariram sparsha. In Pitta Jwara, burning head and sweating, slightly wet body, wet skin. In Kapha Jwara, mild warm, heaviness, guruta, little clumsy touch. The sparshana of a sharira of a body, where tenderness in muscle and joints were most probably seen in a jwara, stiffness or laxity depending on a dosha. In nadi sparshana, the pulse touch, the fast bounding pulse like a pricking pain type of pricking needle like a nadi in a pitta jwara. In a kapha jwara, the nadi become very slow, weak. Sometimes we have to see through very deeply the kapha jwara nadi. And in a vata jwara, it's a variable, fast, irregular nadi. In a vata jwara, we can see. In modern correlation, we can understand the skin temperature, palpation, correspond to thermometer reading, tactile warmth helps to differentiate the fever types, where it is the 99 fever or 100-degree Fahrenheit fever or 102-degree Fahrenheit fevers. Sometimes there is autonomic changes like a febrile status, like in a malarial fever, the patient have a highly shivering, but after that, patient after 2 hours of fever, automatically patient having a highly profuse sweatings. So the sweating part after the fever is most probably seen in the case of the malarial fever. In the case of a tenderness and myalgia, the palpation reveal the muscle and joint pain correlating with viral and bacterial fever. In the case of the viral and bacterial fever, the throat pain or the congestion over the throat, pain at the deglutations. So when you're feeling that if you touch the throatal part, or you can see the throatal part through the darshana, there is a redness over the throat, swelling over the tonsils, and the patient having difficulty in deglutation, and this type of pain, we can easily go through the darshan and sparshan parikshana of the throatal examination. The pulse examination in nadi sparshana, we have talked about in that also, how the pulse rate, rhythm, and volume, and the ball assessment will happen in the jwara, in the assessment of vata jwara, pitta jwara, or kapha jwara. The distribution of heat is absolutely uneven, and warmth may suggest that localized infection like some type of abscess or a cyst. In abscess part, like there is a slightly reddish discoloration with swelling. There is a warm skin and severe tenderness and pain happen in cellulitis and abscess part at the generalized part where the cellulitis and abscesses occur. So this type of examination of sparshan parikshana, where you can understand the reddish discoloration of the cystitis, and where you can understand that which avastha is going through, like a paka avastha of a pitta, paka avastha. Okay? So there will be not a dosha paka, it's a dhatu paka. Dhatu paka avastha, mainly the rasa, rakta, and mausa dhatu paka avastha is happen in abscess and cellulitis, and by the sparshan parikshana, you easily understand the warmness, swelling, tenderness over that part. So we need to go through with the pitta shavana chikitsa over that, and pitta shavana lepa on that part of the body where the abscess or the cyst cellulitis is occurs. It actually go with the dhatu paka and vidradi part of the body. So in Ayurvedic part, we can go through the Ushnata, Shitalta, Rukshata, Snigdata, according to the classification of fever by dosha that we have already talked. So in modern physiology we need to understand the controlled heat and cold reflexes of the body, controlled by the hypothalamus preoptic area. Heat produced by the metabolism and muscle activity, or by some infection or by bacterial infection. And this heat is lost through sweating, vasodilation, and respiration. In the same case of the cold regulation, hypothalamus triggers the shivering and vasoconstriction, and the brown adipose tissue. This actually generates the heat by the signal of the hypothalamus to control the cold, and the behavioral responses against the cold is that the extra clothing and shelter. This is the body behavioral response through highly cold atmosphere. So how this is actually happens in modern physiology, we can call hyperthermia, hypothermia, inflammation, and fever. I think, do you understand? इतना समझ में आ रहा है? How the sparshana parikshana is helps. Now look at the temperature touch physiology in modern scientific perspectives, that all the control centers of temperature is controlled by the hypothalamus, where the preoptic area of anterior hypothalamus. The heat production is actually cellular metabolism. Through cellular metabolism, heat is produced, like when. So when I always want I always think that whatever the heat is produced into cellular metabolism through ATP transformation or ATP breakdown, that is where the Agni is actually situated. That is where the Dhatuvagni is actually situated. Okay. So whenever there is a muscle activities occurs, like contraction, relaxation, shivering, exercises. Okay. So in this type of muscle activity, the calcium channel is most probably used in the contraction of the muscle. So as soon as the contraction is occurring, the ATP energy is used in the form of the glucose. By the breakdown of the glucose, and the ATP is used in the process of the contraction, and so there will be a release of ATP energy. There will be release of the heat. Okay, and sometimes there will be hormonal influences, like thyroid hormones or catecholamines. These are the hormones are most probably used in muscular activity, in body activity, in body growth, and some type of pituitary hormones also is mostly used in the secretion of the estrogen and testosterone, where the muscle activity is most probably happens, where the more and more muscle contraction is occurred, and more muscle waste like creatinine is lost, and so there will be a more amount of ATP energy is increases, and there will be a heat is produced during the time of the muscular exercises. And so this heat is increased in a lots of amounts. So body is neutralizing this heat through the hypothalamus by secretion of more amount of potassium ion by relaxing the muscles, more amount of potassium ion by relaxing the muscle from intracellular to the say extracellular part, more amount of water is excreted through the cellular level. Whenever there is an increased amount of heat is occur, so through what we call in a renal tubular absorption, to maintain the acid base balance, the more amount of water is absorbed through the through the glomerular filtration, through the tubular absorption, more amount of H2O is increased, and that leads to by that leads to increase the blood pressure, which more prominently by high amount of heat, by high amount of sweating, by high amount of perspiration of body. So the blood pressure is getting low down, and by angiotensin mechanism of the aldosterone hormones, by angiotensin mechanism, by aldosterone hormones, and by adenocorticotropic hormones from the pituitary gland. These two hormones are helpful to absorption of the water through renal tubular filtration. So these are the actually physiology is occur whenever there is a temperature or whenever there is a highly sweating, whenever there is a highly cold nature of the body is occur. So when there is a this is we're talking about the heat production, but when we're talking about the coldness, in the case of the vasoconstriction, shivering in bacterial or viral infection, where most probably due to the viral or bacterial infection, thus in cellular level the metabolism, there is a most amount of histamine secretion is occur. This histamine is responsible for the allergic reaction in the cellular level that leads to the itching, shivering, vasoconstriction, this type of so body also reacts over antihistaminic activity occurs in the body, like uh, in that cases. So this type of metabolism is occurs in the cold regulation also, where hypothermia, prolonged hypothermia exposing to the metabolic slowdown and cardiac arrhythmia. When we go through the वेरी कोल्ड क्लाइमेटिक कंडीशन, जहाँ पे हम वहाँ पे जब कोल्ड क्लाइमेटिक कंडीशन में जाते हैं, इन एक्सट्रीम कोल्ड कंडीशन, so the frostbite and this type of local tissue freezing, this happen, and again body is secretion more amount of histamine in that condition, and uh, vasoconstriction is occurring. So the vasodilation is the main type of treatment in this type of treatment, and that will also triggers through vasodilation from hypothalamus. A touch physiology is actually what all over the responses through tactile examination or by touch examination or by sensation examination or by motor reflexes or by all reflexes which are under control of receptors in skin, like steady pressure or texture or light touch vibration. These are major corpuscle responses or receptors, like light responses through iris, the construction to the contraction of the pupil or the relaxation dilation of the pupil is against the light reflexes, and this is also we can see through the darshan parikshana. So identifying the skin warmth, coldness, tenderness, edema like a pitting or non-pitting during the condition of a shotha, muscular tone, rigidity, tremors, pulse rate, rhythm, volume, bala, gati. These all part we can understand through sparshan parikshana. So the key elements in modern respiratory examination were a chest examination, where we can understanding the by stethoscope we can understand the normal breathing sounds, which is a soft or low pitch or high pitch, a bronchial respiration, and the sounds of bronchial respiration we can understand to the sparshan parikshana of the stethoscope, and by hearing the sounds of louder heard or the low pitch through the over tracheal area. In pneumotic condition, also we can hear the sounds of the creeping sound or the crackling sound or the crunching sound of the liquid deposition over the pneumatical part. Sometime in asthmatic part through the uh, what we call through the asthmatic part where the alveolar dryness, and through the alveolar dryness we can see the wheezing sounds more from the narrow airspace like asthma and COPD patients. Sometime in bronchitis or interstitial alveolar infection, where low pitch snoring sounds, most probably in COPD patient, we can see this bronchi and snoring sound from secretion in large airways. This is where also the histaminic secretion is more prominently seen. In pleural rub, most probably in the case of a pleuritis, where if a patient having a pneumonia or the patient having a tubercular pleural effusion, after the proper treatment like AKD or anti-tubercular drugs therapy for a longer time of 6 months to 12 months, even if the patient feeling better, patient doesn't have any pain, patient don't have coughing, no fever, but still when the patient having a deep breathing, and the patient having a deep breathing, a patient still having the grating sound in pleuritis, and patient still feeling some touching of when the patient having a deep breathing. So the pleura is getting very sclerotic. The pleura is getting sclerotic because the effusion part where the liquid is deposited, that is get healed, it becomes sclerotic region. And this sclerotic region is when the patient getting deep breath, it touch through the nerve ending, and the patient having a slightly pain during the highly inspiration. In many time, in the case of a pneumothorax and massive effusion and severe obstruction, we can see the absent of the breathing sound. We told the patient to take a highly breathe to inspiration, but you unable to hear the sounds of breathing in the particular part of the pneumothorax and this. So in this way, we can correlate through the auscultation method, through the stethoscope, and through asthma, the chest tightness in COPD, barrel chest, in pneumonia, localized tenderness, increased fremitus, in pleural effusion, decreased expansion, absent of fremitus, in pneumothorax, hyperresonance, in interstitial lung disease, there is a reduced expansion, frying crepitation, in bronchiectasis, localized tenderness, comb fremitus, in tuberculosis, variable expansion and localized tenderness. And what we see in auscultation through stethoscope in tuberculosis, that is cavernous breath sound or crackling breath sounds. In bronchiectasis, we can see the rhonchi. In interstitial lung disease, we can see the fine and inspiratory crackles. When the in interstitial disease, at the start of the inspiration, you have a very good sound, but at the end of the inspiration, you can find the crackling sound at the alveolar level. In pneumothorax, the absent of breath sounds, effusion, approximately you can see the uh, intercostal region, right intercostal area or the left intercostal area, where through the gravitation, the fluid is deposited at the axillary at the axillary line through the right or the left in coastal area. So, in pneumonia cases, bronchial breath sound; in COPD, wheezing and bronchi sounds; in asthma, particularly in asthma, we can find the typical classical wheezing sounds. And in Ayurveda also, ki asino labhyate sokyam shayano vata piditaha. This has been explained. And we can see by darshan parikshana that the yes, Harsha. In asthmatic patient also we can see that by darshan parikshana the patient feeling better by sitting, and he having the opening mouth inspiration. The patient unable to take a inspiration through nose, but he can easily taking the breathing through the mouth, and he feeling better when he sit, and he feeling difficulty while taking breathing in a lie down position. थोड़ा गर्म पानी दे रहे प्याला. So, in the cases of abdominal examination inspection, we can understand the in the case of ascites or obstruction when we palpate the abdominal part. So, in sparshan parikshana, we can understanding the. So, first of all, you must know how the abdominal palpation is occurs through during the clinical examination. We have to take the both legs folded from lie down position of the patient and see the liver part and see the spleen part. You can resonance the sounds of the abdominal part while looking the abdominal examination. So there will be a rigid sound, there will be a tough sound, there will be a resonance sound, there will be a various liquid form sounds. So these are the different sounds we can see while examination of the abdominal palpation method. Okay, so here in sparshan parikshana we can see also the dilated veins due to the portal hypertension, scars, the movements of the peristalsis, movements of the intestine also occurs in the cases of intestinal obstruction. What we exactly see in abdominal palpation? In abdominal palpation, what we exactly see? First of all, the superficial palpation. Just we see the every quadrant of the abdomen, upper hypochondric, lower hypochondric area, or the lumbar area, or the epigastric area, the upper part of the epigastric, lower part of the epigastric. Okay, so these nine quadrant we're going to see in each every part where the palpation. First is on the right upper part of the hypochondric area where we see the liver part, liver borders, and in above part we can go through the kidney part, and in above we can go through the right hypochondric area where we can actually see the cecum, intestinal part, and the appendicular part where these are the point we actually go in lower epigastric area. We see the bladder, we see the bladder part, and above the epigastric, in the middle part of the epigastric where the grahani, nabhi, grahani, pancreas, uh, the water of ampulla, where the junctions, and now in above part, the upper epigastric part where we mostly see in the gastrical part, where most probably the patient feeling of gastritis, esophagitis, this type of pain patient might be feeling, and in epigastric area patient might having a duodenitis, and in the lower epigastric area patient might having a cystitis type of pain in the gallbladder, in the urinary bladder area, in the right hypochondric area, where the appendicitis or the colitis type of pain we might be having, in the upper part where the renal part, middle hypochondric area where the renal part, where most probably at the back of the part of the middle hypochondric, where renal calculal pain mostly we seen, and in the upper right hypochondric area, where the liver border we see the gallbladder, sometimes we see the fatty liver, we see the cholelithiasis pain. This type of pain we can see over there. And mostly always I feel that whenever there is a krumi, or the pain due to the krumi, like a cystitis or colitis type of pain, it is because of, at the right side of the body, is because of the krumi. And we're talking about the left splenical flexure area. In left splenical flexure area of the intestine, where we can find the hyper growth of spleen area, and in below that also we can see the pancreatitis area, where we can mostly see the pancreatic pain. And in the lower part also we can see sometimes the cystitis type of pain, or the renal calcular pain also we can see in a left hypochondric area. So these are the mainly part we can see in superficial and deep palpation of the abdominal examination. So in clinical application, we must have to go through it and understand the avastha of the patient. Is it from pitta prakopa avastha, or a dhatu paka avastha, and we have to treat accordingly to that patient. Most probably in the percussion area, the gas filled bowel, where when you examine the, by tapping the abdomen, we understand this fullness of gas. The dull sound most probably we see in the case of the ascites or the udara patient, where the liquid sound we understand. And sometimes when you moving the patient from right to left, the dull sound is getting shifted from one part to the another part. So in the case of the atisara also, in the case of atisara also, the more peristaltic sound we hear in the abdomen, normally that not much of amount of peristaltic movement we have seen. But in the case of the auscultation of vowel sounds, in the case of atisara, or in the case of the atyartava, we see the more vowel sound. Or in the case of vata vyadhi, pakshaghata also, we see the more peristaltic movement sounds in abdomen. Sometimes when a baby or a male having intestinal obstruction, that time also the tenderness and obstruction, tenderness and mostly in abdominal obstruction or intestinal obstruction or intestinal interception, in baby mostly just vomit, continuously vomiting is happen. Whatever she or baby is intaking, the continuously vomiting procedure is happen. Patient morely admitted in the hospital, all saline or liquid diet is actually for patient. Still, even anti-emetic drugs is going, but patient still vomited. So that is the main classical symptoms of the abdominal obstruction. We see that, yeah, there is something interception or obstruction is occurs, and that because of that there will be a vomiting is occur. Because in after giving the anti-emetic drug, the vomiting will must be stopped in 2 to 3 days, but it does not happen. So there is a serious alarm is happening that must to be understand in the further treatment. So friends, we going to stop here, and tomorrow lecture we go further regarding this sparshan and prashnai parikshana. So what remain in this part is the, yes, the mostly I have covered in the hernial part also, in hernia or in the uh, testicular torsion or in hernial part. What we understand in umbilical hernia or inguinal hernia is the mostly what we understand is when the patient is trying to cough, the umbilical hernia is pop out, or in inguinal hernia also, when we tell the patient to stand up and take your leg up and get it down very fastly, the patient feeling a very tear pain at the inguinal and testicular area. In hydrocele part also, in sparshan parikshana, by the torch test, we can understand the, we can see the liquid deposition in the hernial part, or in the scrotal hernial part, or in the hydrocele part. We can understand, we can see in hydrocele the large amount of liquid deposition, accumulation in the hydrocele part. In the inguinal hernia also, when patient trying to cough, when we say the patient to lie down and bend his knees and see and tell the patient to cough out, and that time also the patient, patient having the popping of inguinal hernia, and there is a pop of the inguinal hernia when he cough out, that we can understand this, yeah, this is the complete or incomplete hernia, we will get to know. So in that case also, in which condition we have to go through the medicinal part, and in which way condition we have to go to the surgical part, that if it is a complete hernia we have to go through the surgery. So that are the major sparshan parikshana we go through, by touch, temperature, pulse, abdominal percussion, palpation, through torch examination, to understanding the reflexes, to understanding the power or motor and sensory reflexes. So these all are the ways of understanding the clinical diagnostic methods of sparshan parikshana. Okay, so tomorrow we're going to learn the prashna parikshana. So prashna parikshana, we're going to understand the questioner, how to take the case taking in ayurvedic way, how to take the history, how to take the cases in ayurvedic method. Till then, namaskar.